So you finally did it. You booked your very first therapy session, and now your mind is racing. What are they going to ask me? Do I have to tell them about everything? What happens if I freeze? And how do I even prepare for this? If that is you right now, pause for a second. That nervous energy you are feeling is completely normal. In today's video, we are breaking down exactly what usually happens in a very first therapy session and how can you prepare yourself without overthinking it. Let's take the mystery out of it. Hi everyone, welcome back. If you are new here, I talk about counseling, mental health, and what therapy is actually like, especially for those who are just starting out. The first session feels scary for one main reason: uncertainty. When we don't know what to expect, our brain fills in the blank, usually with the worst case scenarios. So let's replace those assumptions with clarity. Most first sessions are also called an intake session, but do not let those words scare you. It's not about interrogation, it is more of a structured conversation. Your therapist will probably begin with something quite casual and straightforward, like what brings you here today, or what makes you decide to seek therapy now. They are not looking for a perfect answer. They are trying to understand what feels most important to you right at this moment. From there, they will likely explore the history of your concern. When did it begin? Has it happened before? What makes it worse? What has made it slightly better? They are listening for the patterns, not judging your stories. Then the conversation may widen a bit. You might be asked about your family background, your relationship, your work stress, major life event, physical health, and possibly substance use if relevant. This is not about them being nosy. That's because mental health doesn't exist in isolation. Your therapist is actually forming a big picture to understand your life context. Those questions can feel uncomfortable at times, but they are standard and they are asked to ensure your circumstance, not to label you. Toward the end, your therapist will likely ask you about your goals. So, what would you like to feel differently? What kind of improvement are you looking to achieve? You don't have to come up with a polished answer, even something like, I just want to feel less overwhelmed. It's more than enough. Now let's clear about a few common fears. Your therapist is not expecting you to deliver a perfectly organized life story. They are observing, listening, building connections. The first session is as much as about you seeing whether you feel comfortable with your therapist as it is about informational gathering. Think of it as a two-way evaluation. Now let's talk about preparation. First, gently reflect on why you are going to therapy. Ask yourself, what has been weighing on me? What feels heavy lately? What would I like to change? You don't need to come up with bullet points. It's just for clarity for yourself. Second, think about timing. Why now? Oftentimes, like any doctor's visit, something feels off that pushes you to finally book that appointment. Identifying that turning point can help start that conversation. Third, manage expectations. The first session is rarely a groundbreaking breakthrough. It is more like a foundational building session. You are laying the groundwork for deeper work later. Fourth, take care of any practical details. If the session takes place virtually, make sure you have privacy. Give yourself space before and after so you are not rushing into another commitment. And here's something very important. You do not need to prepare for a full timeline. You do not have to disclose everything at first. You set the pace. So what if I freeze? This is one of the biggest fear. What if I don't know what to say? If this happens, you can simply say that, I don't know where to start. That sentence is enough. A skilled therapist knows how to gently guide the conversation from there. Instead, ask yourself, instead of asking yourself, how do I prepare perfectly, try asking, how can I show up to the therapist honestly? You are not being graded. You are beginning a collaborative process. And always remember, you are also evaluating your therapist. After the session, ask yourself, did I feel heard? Did I feel respected? Do I feel safe to ever come back again? Suitability also matters. If your first session is coming up, hear this clearly. It is okay to feel anxious and not know what to say. It is a major decision to invest in your mental and emotional well-being. You have already made a progress just by showing up. If this video helps you, consider liking and subscribing for more content related to counseling and mental health. And if you have already had your first session, I would love to know what surprised you the most. I'll see you in the next video.